We're live.
All right. Hey, everybody. This is Matt Ferry, candidate for State House 48. And this
And
is Brandon Thomas. Yeah, introduce.
yes.
Sorry.
Hey, everybody. This is Brandon Thomas. Hopefully, we are simulcasting. I guess that's the right phrase on my page and Matt Ferry's page. This is some new fandangled technology that us older millennials are having to adapt to.
Yeah. Yeah. Definitely feel like an old man
Yeah.
navigating some of this stuff, but I think it's working. It appears to be working.
Yeah.
And
I see the live logo, so that's
yeah,
good.
I see one person has joined us, so that's good.
Awesome.
Um,
And
but
feel free to leave comments so we can chat about that. I think Matt, you have access to that on your side. If
okay.
anybody leaves a comment, let's talk about it.
Okay, sounds good. So I wanted to call you up today and talk to you a little bit about everything that's going on. Obviously, most of our conversation is probably going to center around COVID-19 situation, but
Right.
with this COVID-19 situation, all of our problems that we've had in our society are kind of magnified. You know, whether it's the healthcare or economic system, we got a lot of problems out there, and that we have not properly addressed over the years. And COVID-19 has really opened that can of worms. So anyway, recently Bill Lee said that he's opening up May 1st or 2nd.
May 1st, May Day.
Right, May Day, yeah. And of course, I want us to be open again. I want the economy to be open again. I want so many people to not be out of work. At the same time, I want people to be safe, and I don't want a whole lot of people dying over the COVID or having to go to the hospital and then there being problems with too many people at the hospital. So, what's your take on this?
Yeah, so when this whole thing started, I heard the numbers that 80% of people who get it will be okay. 15% will be hospitalized and 5% won't make it. And that's just percentages, but that's a big number. All right. When you're talking about the whole country, 5% of people that, end up getting 15% of those people that end up getting hospitalized probably aren't going to make it. Yeah. This has to be taken very seriously. I'm actually a little taken aback because Governor Lee is not even following Trump's recommendations. So, So how it was presented earlier this week was there was basically, they called it like a gate. So you had to get through the gate before you started your phases. And one of the main criteria was a decline in positive tests for 14 days. And then so once you start seeing those declines in numbers, you can start phase one, which is reopening certain businesses and still adhering to social distancing and everything else. And there's a phase two and a phase three. We've just said, nah, let's open it all back up. And that's very concerning, because this is a very serious issue. I think it's going to, people are saying it's going to reappear. It's definitely going to reappear now, right? For sure. And we have to be aware of that. One thing, we weren't ready for COVID. And I also heard, what happens when we have a pandemic flu? Because that is probably going to be coming around the corner too. And so it's really important for us, and we can talk about how, we think we would handle this as legislators, but it's really important for us to start thinking about, what does healthcare look like now?
Yeah.
What does workers' rights look like now? What does education look right now? Especially post-COVID. It was issues that needed to be addressed pre-COVID, but they demand being addressed now.
Yeah, absolutely agree with that. I think it is maybe premature to get everybody up and running again. I understand the frustration. I myself have some financial difficulties. I know some people down the street from me desperately need to go back to work. But if it's at the cost of people's lives, we definitely need to rethink that. I know there's a lot of people who have filed for unemployment and
Right.
some of them have gotten it and some of them haven't. I
Right.
know some
That's
small business owners
yeah.
that have, I mean,
I got a little one right here. Sorry, that's why I
yeah,
made
it's all
that
good.
face.
It's all good.
Can you
Hey,
wave? Can you wave, everybody? You want me to catch this ball? Yeah. So
but
what you were saying? Yeah.
yeah, I got a friend who he applied for that small business loan. I forgot what
Uh-huh.
they called it, the PPP. And he said, well, they ran out of money. They told me they didn't have any money. Well, we know that, places like Roofs, Chris's Steakhouse, which is not a mom and pop store.
Yeah.
They have millions of dollars. They got, a windfall from that. Whereas a lot of small businesses, around the country did not, like my buddies. So
Yeah, and I really feel for them because obviously they're starting something that obviously there's risk involved when starting a business, but you don't anticipate this kind of risk, right? like
right.
like like this isn't in the cards. So
Mm-hmm.
yeah, I really feel for them, and I understand that how they want to reopen. And I think this just really shows a failure of leadership and a failure of our government being able to support those local businesses. If they really cared, if Governor Lee and the people that represent me and you at the state level really cared about these small businesses, they would be fundamentally doing stuff that protects their business, but also protects the safety of everyone that wants to patronize that business.
Right. Absolutely. And the the state is going to open up back for business. I know it's a phased thing, and I know certain counties are going to go a little bit longer, but it's kind of up to the employer at that point.
Yeah.
And a lot of people, I mean, it's going to be a hard decision. I understand it, but what is the average person going to do who is living paycheck to paycheck?
Yeah.
Do they even have the opportunity to say, no, I can stay home another week or two? Or
Yeah.
they say,
Yeah.
I got to get that paycheck,
Yeah. Exactly. Exactly.
And I mean, are they guaranteed any paid leave if they get COVID? My guess is not.
Well,
So,
it depends on your company. So I know, and then probably devil's in the details on this, but I know Walmart was going to be offering something, right? If you get it, or and so there's something there. But we need a statewide policy. It's not just about COVID, really. It's about
mhm,
anything can happen to anybody, and
right.
especially now that we have this out and around, this is going to be with us for a while. Some people are saying this is going to be with us for over 2 years.
Hmm.
So when we get back to whatever the new normal is, we're still going to need to address our paid leave policies. We're still going to need to address our health care, which is another one. So before we started this campaign, before you and I started our campaigns for this cycle, there were about 700,000 Tennesseans without access to health care, without health care coverage, period.
Right.
I suspect that has went up significantly due to people being laid off and having to file for unemployment.
I think so too.
Yeah. And so how are those people supposed to the test is free, but we've been seeing cases where, oh, if you want us to grade the test, it's not, right?
Right.
You need to get the x-ray, you get admitted to the hospital,
Mhm.
and you get thousands and thousands of dollars worth of bills now, all because you needed one test. We're going to start seeing that as well. We have seen it. Um, and so yeah, it's a mess that hasn't been addressed. It's about time we address it here in the state of Tennessee. I even think the healthcare industry realizes that basically this employer-based system is on shaky ground, and
Yeah.
I think COVID really blew it up. Um,
Mhm.
I don't feel bad for the healthcare industry. They're going to be fine. They diversify. They find ways to make money. If it's not selling healthcare insurance, it's going to be something else. So I really care about people who need access to healthcare, quality, affordable healthcare. And so that's part of my campaign platform, and it makes even more sense now because of COVID.
Mhm. I would, yeah, absolutely agree with that. And we were talking the other day about, there's still the state in that last budget put $40 million into a fund for the voucher bill to help pay
Hmm.
for the voucher bill,
Hmm.
which the voucher bill, I'm all about school choice, But when you're talking about taking public money away from public schools and giving it to private schools to help subsidize, somebody's education who already has the money to afford to go to that kind of private institute, there's something very wrong with that. And especially right now during this crisis, to think that that is the most important thing to do is outrageous.
It's like, well, what about the kids that aren't going to school now for the rest of the year, right? How me and Rutherford County gets really rural really fast, and so and there are spots in our county where there is no access to internet. What are these kids supposed to do? With regarding remote learning, that's an issue that's not being addressed, and that's definitely not going to be addressed with this voucher situation.
Mm-hmm. And you got parents who have to act like teachers now, even though they're maybe still having to juggle a job or two.
Yes.
So that's a really complicated situation. I know I've got a friend in Mount Juliet, and he said that his daughter is supposed to go to a new high school next year. Well, they had the tornadoes hit, and then it was spring break, and then COVID hit. And I mean, he's just like, it's done for the rest of the year, and it's looking like she's not going to be able to go to her first year of high school until September.
Wow.
So I mean, that's a 6 months gap right there. Yeah. And he's a pretty smart person. She's a pretty smart girl. She does a lot of reading on her own and stuff like that. But like for some people who really, really, really need to focus on that kind of thing, now they're at home.
Yeah.
12 hours a day, and they might not have that incentive or that push to finish that work.
Yeah, I think I would have been in that boat. You would have been very hard pressed to get me when I was in middle school or high school. If this situation happened, to get me to actually do the work remotely. I don't know. It just speaks to definitely something needs to change. And so I don't know what our governor thinks he's doing with this voucher situation. But we need to, I understand what he's doing, right? He probably has some investments in it, right? There's probably something he gains from it, but we don't even know how much the previous governor made. We don't know how much Bill Lee's making, where his interests lie. We also, when we get in there in November, we need to pass a bill that shines a light of transparency on the governorship. We need to know how these folks are making their living. When you and I run for office, we have to follow these particular disclosures on where our income's coming from with the ethics board. When you're a governor and you have not even a small business, you have a business, right. You have a certified, probably multi-billion-dollar business year over year. And if you're that kind of person, you're probably making some investments elsewhere as well, diversifying as they tell you should do. We need to know that as taxpayers,
right?
As well.
Absolutely. I'm all about making money, but if you're making money off the backs of other people, or you're taking advantage of people, or you're taking advantage of your office, that's absolutely wrong. We did see that with Bill Haslam. He did try to privatize, state universities and other things like that. And some people who were fans of his pointed to Flying J and how great that business was. Well, Flying J pilot was in the middle of a huge scandal at the time that Bill Haslam did not want to be associated with. And I don't think any Haslam got in trouble for at the end of the day. Surprise. But I mean, just having someone who's good at business is not necessarily the most desirable trait for somebody, to hold elected office, especially something like governor. And this guy, I mean, Bill Lee seems like a nice man, but he's really have no experience in governing or anything else before this time period. And I'm worried about who he listens to. If he's listening to these people who are just saying, just open up already, instead of the medical experts, we got a problem,
Yeah, I think that's been the case, right? It's clear that they aren't listening to the epidemiologists.
Right.
Because if they were listening to these folks, we may have not had, it's theoretically possible to assume if we acted quickly enough, we wouldn't have had to do a major shutdown.
Right.
So, the first, the process, which should have taken place had they listened to the epidemiologist, would have been, once we got our first case, once we had, our first death, we isolate, we quarantine that situation, we trace back, we
Yes.
contact trace, we mitigate where we can.
Right.
We may have to slow down the economy in certain pockets of the state to, and have some social distancing going on there, to contain the virus, basically. And that we didn't see that. And we didn't see that at the national level, which I think a lot of governors took, that particular leadership. Well, if the national government's not concerned about it, why should I be?
Right.
Which, a few years ago, it was the other way around. It was the national government was the bad guy. So, I think that we obviously need new leadership. We need people standing up and speaking out. We need folks to contact Governor Lee's office and have him reconsider this. We need people making phone calls. I actually had somebody say, "What can we do?" These are the things you can do, and obviously show up in November, and elect new folks that are concerned about this, that actually believe in science.
Yeah,
I
that
think
was nice. Yeah.
I think that's another divide that we have. In Governor Lee's party is, science isn't a big doesn't make a big impression
Right.
the first time they read something or hear something. So, yeah, we need leadership that's going to take all these things into consideration, and make the best judgment, for everybody.
Yeah, I would agree. And this has really, shifted the conversation, about what we can afford in this country.
Right.
I worked on Medicaid expansion for years, and I remember then Senator Ketron and then Senator Tracy said the exact same thing. They were not in the same room. This was not the same day either, but they said the exact same thing. We can't afford it. We can't afford it. We can't afford it. And we would sit there and go, 90% of it is paid by the federal government, and the Tennessee Hospital Association, they'll take the rest.
Yeah.
So there's no added cost.
Yeah.
Why? Oh, we can't trust the feds. And they're still saying that kind of thing, even though it's all owned by Republicans. So it's really a bad faith argument to say that, especially in light of all the stimulus money that they just whipped up out of the air. And
we didn't ask how we were going to pay for that, did we?
Right.
That was never a debate. It was like, no, we need this money. People need a paycheck. They need to pay their rent. Like, legitimate, that's legitimate. Yeah.
Right.
But they didn't ask how we were going to pay for it.
Right. No, they did not. No, they did not. And as we see what they're doing with the money, it's not necessarily going to the people that need it.
Right.
So they're seeing another, payday for them.
Right.
They're just trying to grab that cash. But one thing I did want to discuss with you, and then, I know you got to go and I got to get out of here too. But I watched the Put People First press conference.
Okay.
Wondering if I should call it a press conference or not, but it was technically a press conference, all done the same way, video conferencing.
Did they take questions?
And they did take questions.
Okay, so it's a press conference. Yeah.
And it had representatives like AOC was on there, Alexandria Ocasio-Cortez, Ayanna Presley was on there, Ilhan Omar, Mark Pokin. And I always get her name wrong. The legislator from Washington. Do you know what I'm talking about? Like Pramila?
I do not.
Jayapal. I always get her name wrong. She's amazing, though. She's great.
Okay.
But I just want to tell you, like, I listened to the whole thing, and it was really good, really informative. And, like, some of the things that they're fighting for, that they want to see in this next stimulus bill, because, of course, there's going to be another one, is they want to keep people on the payroll. They want to solidify, payroll protection for everybody. They want to provide financial relief, whether that's, in regards to direct healthcare cost or something, around that, because there's a lot of people who now they have, to spend money on wet wipes and Purell and mask and all kinds of things. By the way, this is my mask right here. I was out earlier today. And I did this little thing where I'm putting a paper towel in there and folding it, and that usually works as a temporary mask.
Okay, interesting.
Yeah, it's
Okay.
not good for work because it'll fall off my head, but I got a different one and it's being cleaned right now. But it's pretty much the same thing. You stick a little paper towel or coffee filter in it, and it works.
Okay.
Anyway, it's all about protecting public health, but the last thing on here is also defending federal elections, and so they're very interested in that. Of course, we want to see that here in Tennessee. We want to see mail-in ballots. That's what I want to see. I mean, we don't want when it was suggested that something different would have to be done this year, when our General Assembly was still around, the Republicans said, okay, we don't want mail-in ballots, though. We want super sites. We want to have giant voting centers to help the situation. And that's not helpful, obviously. And mail-in ballots is
it's like Walmart wanting 5 more Walmarts in Murfreesboro, huh?
Right. Yeah, exactly. Like, yeah, right. The problem isn't, that there's voting centers. It's ridiculous. And they're so against mail-in ballots. But I'll tell you something, this year, we really have to push on that. We really have to get that done. The legislature is back in June. So that's something that I know you and me are going to be pushing on other people to sign up to really push mail-in ballots, because it's going to make a huge difference this year. And we can't super sites. That's just it's absolutely.
It sounds like super COVID 20. You know what I mean?
Right? Like, yeah. Right.
Like that is not the solution to this problem. We're going to need to continue social distancing for a while, and so it's going to be really interesting to see how we end up campaigning.
Right.
Because like we can't do that. No. They need to get over themselves, and we need to pass absentee balloting for everybody.
Yes.
As it stands, there are like 6 or 7 different reasons you can receive an absentee ballot. But what we've seen in other states is when a state is not used to it, sending out the ballots and receiving the ballots, you run into some issues. So we need to jump on this immediately. We need to get the infrastructure in place immediately. Like we can't wait till like October to decide, hey, we need we need absentee balloting.
Or even by August,
by August. The primaries, exactly. Yeah. Well, I don't have a primary, so I can just look to November.
Is there like, because I know this is all different. I know like Murfreesboro City is usually in August. Is Smyrna City or Laverne City is it August, or is that November?
It depends. Yeah, I have to look at that since. It may be next year. I'm not sure. You have to look at the calendar.
Right. I know there's
how that falls. Yeah.
Yeah. I think it's going to be a very interesting year. I think that that this COVID-19 situation has definitely woken a lot of people up to the problems that we were having in our society before COVID. And we're just going to keep pushing on these issues about how healthcare is important. Education is important. We need to invest in our people. The weakest among us is going to affect all of us. So we shouldn't just help them for humane reasons. We should be selfish too and think about ourselves and helping that other person, and really denying them healthcare or the right to healthcare, affordable healthcare, or anything else is really is really not right in my opinion. Anyway, I'm off my high horse on it now.
Well, and I just kind of want to insert here, we'll see. And I know it happens all the time. The Republicans like to use MLK. They like to quote him all the time. So we need to tell them to stop until they pass Medicare expansion, until they have a workers' bill of rights, until they ensure that our children are being educated and public schools are funded, until we actually have criminal justice reform, ending cash bail and decriminalizing marijuana. They have no right to use MLK's legacy, because they don't live by it in their vote. You can just look. They don't live by it in their day to day.
Right.
So that is kind of a little shot across the bow, because my opponent does like to use MLK, and it's very disrespectful.
Yes.
because he's not voting the way he should be if he really believes the words that MLK says.
Absolutely.
And so yeah, so I think about it that way. And that my campaign, we're running to create a family-friendly economy that works for everybody, no exceptions,
Mm-hmm.
in the spirit of MLK.
Absolutely. We did talk briefly about prisoners in the state of Tennessee. I mean, it's just like nursing homes. It's a breeding ground for COVID, and I know they're
Yes.
releasing some prisoners, but what are the testing and treatment costs of that? Are those prisoners necessarily going to be taken care of? I'm going to guess no.
Yeah.
And
I saw one in Tennessee. They said they're isolating them. It's like, well, like what? Like how is that? How is that possible? Yeah, how is that even possible? Yeah, first of all, yeah, like
we already have an overcrowded jail, right?
Yeah.
So, well, we can sit here and talk about this all day, but we will save it for another day. Thank you so much for joining me on this live stream today, Brandon Thomas.
Thank you.
For District 49, and Matt Ferry here for District 48. We're going to win some seats this year. We're going to flip the state house. We're going to change some things and how things are done, and bring some competent leadership to the state. So anyway, thank you so much for joining us, Brandon. Thank you so much to everyone who joined us here. Stay tuned. We're going to have plenty more videos this summer because we're probably not going to have a chance to really meet y'all in person. So please stay tuned to this page. Thank you so much.
Bye. Thanks.